Streptococcus. This is a gram-positive bacteria, spherical bacteria that characteristically form the pairs or chains. Most are oxidase negative and catalase negative, and many are facultative anaerobes. Most streptococci are the facultative anaerobes, and some are obligate anaerobes. They are non-motile and non-spore forming. According to their oxygen requirement, they are either aerobic or the anaerobic. Aerobic streptococci, according to their action on the RBC in the blood agar, there will be three varieties. Beta hemolytic streptococci, complete hemolysis, that is clear zone around the colonies on the blood agar. Example pyogens. Alpha hemolytic streptococci, partial hemolysis. Example viridin streptococci. Non-hemolytic or the gamma hemolytic streptococci, no hemolysis, no change in the RBC. Example enterococci. Blood agar showing the culture of the streptococci with different types of hemolysis. Note that in gamma hemolysis there is no clear zone, while in beta a prominent clear zone can be seen. Streptococcus, they are classified into three: alpha hemolytic, beta hemolytic and the gamma hemolytic. Green, partial hemolysis; clear, complete hemolysis; and red, there will be no hemolysis. In partial hemolysis, there will be a pneumonia and viridians. Clear, complete hemolysis, there will be pyogens and the Acalactiae. And in the no hemolysis, there will be the enterococcus. Lancefield classification based on the serologic reactivity of the cell wall. Polysaccharide antigens are originally described as R. Lancefield. Greater than 18 groups specific the AGS, AH and KU were established according to the carbohydrate AG present in the cell wall. Group A pyogens, pharyngitis, which affects the diseases like streptococcus throat, scarlet fever, impetigo, pneumonia and the rheumatic fever. Group B Agaltiae, which affects the meningitis. Group C Equismulus, causes the endocarditis, bacteremia and the meningitis. Group D Enterococci, UTI endocarditis. Group H Sanguis endocarditis and the dental caries. Group K endocarditis and the caries. Medically important streptococcus are the pyogens. Group A streptococcus. They consist of one species with 40 antigenic types. Pyogens, the most important human pathogen, causing the disease including the suppurative conditions, skin infections, throat infection, systematic infection, non-suppurative sequelae. Streptococcus pyogens morphology. The gram-positive cocci arranged in the chains of varying length and they are non-motile. Some strains are capsulated. The cultural characters like they form minute colonies. It grows on the blood sugar producing the beta hemolysis. Antigens, they are the systemic cytoplasmic membrane. Has the antigens similar to those of the human cardiac skeletal, smooth muscle, heart wave fibroblasts and the neuronal tissue resulting in the molecular mimicry. Virulence factors of the group A streptococci: M protein, fibronectin binding protein and the lipotectic acid for the attachment. Hyaluronic acid capsule inhibits the phagocytosis. Exotoxins such as the pyrogenic toxin causes the rash of scarlet fever and the cytotoxic toxic syndrome. Invasins like streptokinase, streptodornis, hyaluronidase and streptolysins. Protein antigen. Yes, pyogens divided into types based on the content of M protein. About 80 types is described. M protein, the most important virulence factor, is antiphagocytic. Promotes the adherence to the host epithelial cell. The protein and the other cell wall antigen have the important role in the pathogenesis of the rheumatic fever. Antibodies to these components react with the cardiac muscle tissue. Other antigens are the T and the R proteins, but they are not related to the virulence. Toxins and the enzymes. More than 20 extracellular products that are antigenic are produced by the S pyogens. Some of the important toxins and the enzymes include streptokinase, transforms the plasminogen of the human plasma into plasmin, an active proteolytic enzyme that digests the fibrin and other protein which can dissolve the fibrin in clots. Thrombi and emboli causes the fibrinolysis. Streptococcus deoxyribonuclease depolymerases the DNA. They are the DNases type A, B, C, D that break down the DNA. Hyaluronidase. It destroys the hyaluronic acid, the cement substance of the connective tissue. It helps spreading of infection. Streptococcal pyrogenic endotoxin, formerly erythrogenic toxin, an exotoxin produced by some strains of the group A streptococci, act as superantigens. It causes a vasodilation of the capillaries, leading to the rash of scarlet fever. Streptolysis, there are two types, streptolysin O, streptolysin S. O2 label, O2 stable, antigenic. This stimulates the production of anti-streptolysin, that are the antibodies that can be measured in patient serum. Non-antigenic, does not stimulate the production of AB. It hemolyzes the red cells and is responsible for the beta hemolysis produced on the blood agar. Protein antigens are the M protein and the T and R protein. Enzymes like hyaluronidase, streptococcus, streptokinase and streptolysin. Toxins like streptococcal pyrogenic exotoxin. This is caused by invasion of S. pyrogens. Erysipelas, if the portal of entry is the skin, erysipelas, they result massive brawny edema and a rapidly advancing infections will be caused. Cellulitis, an acute, rapidly spreading infection of the skin and the subcutaneous tissue. It follows the infection associated with a mild trauma, burns, wounds or the surgical incision. Pain, tenderness, swelling and the erythema occur. Necrotizing facilities, streptococcal gangrene, the infection of the subcutaneous tissues and the fascia, extensive and very rapidly spreading necrosis of the skin and the subcutaneous tissues. The group is streptococci that causes the necrotizing facilities have sometimes been termed flesh-eating bacteria. A major risk factor for the development of the streptococcal necrotizing facilities is a history of recent varicella zoster virus infection. Bacteremia or sepsis. The infection of the trauma or the surgical wound with the streptococci results in the bacteremia, which rapidly can be fatal. As pyogens, bacteremia can also follow the skin infections such as cellulitis and pharyngitis. This is caused by the local infection with the pyogens. Most common infection is pyogens other to the pharyngeal epithelium by means of lipoteichoic acid. The glycoprotein fibronectin on the epithelial cells probably serve as a lipoteichoic acid ligand. Cervical lymph nodes are usually enlarged. Intense nasopharyngitis, tonsillitis and intense redness, edema of the mucous membrane with the purulent exudate and high fever will be the symptoms. A similar clinical thing can be occur with the infectious mononucleosis, diphtheria, gonococcal infection and the adenovirus infection. Streptococcal pyoderma or impetigo, the local infection of the superficial layers of skin. It consists of the superficial vesicles that break down. Eroded area is covered with pus and later is encrusted. Highly communicable, especially in hot, humid climate and may progress to cellulitis. Post-streptococcal diseases. Following an acute S. pyogenes infection, there is a later period of 1 to 4 weeks after which the nephritis or the rheumatic fever occasionally develop. Due to the hypersensitivity response, the nephritis is the most commonly preceded by the infection of the skin, is more commonly preceded by the infection of the respiratory tract. Acute glomerulonephritis develops 3 weeks after the S. pyogenes skin infection, specifically in case of M-type infection, initiated by the antigen-antibody complexes on the glomerular basement membrane, the blood and the protein in the urine, edema, high blood pressure and the urea nitrogen retention. May develop the chronic glomerulonephritis with ultimate kidney failure. The majority recover completely. Rheumatic fever results in the damage to heart muscle and valves. Strains of group A streptococci contain the cell membrane antigen that cross-react with the human heart tissue antigen. Preceded by the S. pyogenes, infection in the 1 to 4 weeks earlier may not be detected. Typical symptoms and signs. fever, malaise, a migratory non-suppurative. Polyarthritis and the evidence of the inflammation of all parts of the heart. Carditis leads to the thickened and the deformed valves that are finally replaced by the scar tissue. Can be reactivated by the recurrent streptococcal infection, whereas the nephritis does not. First infection produces only the slight cardiac damage, increases with each subsequent infection. Prophylactic penicillin administration. Gram-positive streptococcal pneumonia, which is a gram-positive one, lancet-shaped diplococci, often seen in the specimen of young culture. In sputum of the pus, single cocci at chain-like can be seen. With age, the organism rapidly become gram-negative and tend to lyse spontaneously. The growth of pneumococci is inhibited around the disc of Optochin. The growth of pneumococci is inhibited around the disc of Optochin, as I said before. Note that the viridians are not inhibited by the Optochin in the E and M phase of the mitosis. Pneumococci are the alpha hemolytic on the blood agar. Production of disease. Produce the disease through the ability to multiply in the tissues. They produce no toxins of the significance. The virulence of the organism is a function of its capsule, which prevents or delays the ingestion by the phagocytes. Loss of natural resistance. The normal respiratory mucosa must possess a natural resistance to the pneumococcus. Viral and other respiratory tract infection that damage the surface cells. Abnormal accumulation of a mucus which protects the pneumococci from the phagocytosis. Bronchial obstruction and the respiratory tract injury due to the irritants distributing its mucociliary function. Alcohol or the drug intoxication, which represses the phagocytic activity, depresses the cough reflex and facilitates the aspiration of the foreign material. Abnormal circulatory dynamics, example heart failure. Other mechanisms, example malnutrition, general weakness, sickle cell anemia, hyposplenism, nephrosis or the complement deficiency. Clinical findings like sudden with high fever chills and sharp pleural pain. Sputum is similar to the alveolar exudate, being characteristically bloody or rusty colored. From the respiratory tract, pneumococci may reach the other sides. Sinuses and the middle ear are most frequently involved. Infection sometimes extends to the meninges. Bacteremia from the pneumonia has a triad of the severe complication: meningitis, endocarditis, and the septic arthritis. With antimicrobial therapy, the illness is usually terminated promptly. Treatment: penicillin G. This is the drug of choice. Some penicillin-resistant strains are resistant to cefotaxime. Resistant to tetracycline and erythromycin also occurs. Pneumococci remains susceptible to the vancomycin. Major ocular infection caused by the streptococcus is acute bacterial conjunctivitis, corneal ulcer, bacterial keratitis, periorbital cellulitis, endophthalmitis. Treatment and the chemo prophylaxis. Penicillin is the drug of choice for the treatment of the streptococcal disease. Penicillin G injection given as a prophylactic measure to children prone to the recurrent attack of the streptococcal sore throat or recurrent attacks of RF. Erythromycin is also affected by erythromycin resistance will be there. Thank you.